Well, I think it's time we need to talk about Gc-MAF or Gc-MAF or Gc-MAF, whatever, but we're going to call it Gc-MAF for the time being. So, what is Gc-MAF besides this new supposed wonder drug? And it is, to all intents and purposes, a wonder drug. Because it can cure cancer, it can cure AIDS, it can cure whatever, Alzheimer's. These people do it. And if you look up Gc-MAF, you'll be taken to one site. What is Gc-MAF? And it is run by Immune Biotech, which they don't tell you. It rubbishes the other two sources where you can buy Gc-MAF, except Biotech Limited, which, by the way, has been stopped from selling Gc-MAF because they discovered that A, it was contaminated, and B, that they were selling a drug. They wanted to license it as a drug, and guess what? It couldn't back up its claims. Surprise, surprise. But you may ask, what is Gc-MAF? Well, it's presented by a guy called Dr. Yamato, who studies the immune system. And basically the whole idea is that, well, his theory is that if you inject cancer patients with Gc-MAF, this should activate your white blood cells to fight cancer. And none of the clinical trials have proven this. In fact, the paper he submitted has been retracted. In fact, I'm going to leave a letter which contains, in fact, I'm going to leave two links, three links as to why this paper was retracted and why it didn't work. In fact, you'll find that all of the papers in this case have all been retracted, because guess what? One of them, and this is the fun one, claimed that all these patients got cured. However, on further inspection, when it was being peer reviewed, they discovered that all these patients had received surgery, chemotherapy, radiation treatments, cancer drugs, all conventional treatments. They just had Gc-MAF as well. So how the hell can they claim in this research paper that Gc-MAF is effective? In fact, there's another paper where they claim that out of these 20 patients, they claim 100% efficiency. But the problem is, to be able to claim that, you can't claim it from such a small sample size. And again, in one of the links I'll show you, if when you read it, it explains why you can't. Because to claim that, you have to at least have 1,000 people to be able to claim 100%, effectiveness. You can't claim it on just 20% people alone. It just does not work like that. And here's the thing, because what they would be claiming, this should be, top tier, it should be truly groundbreaking, and yet the people from Lancet, English Medical Journal, weren't reporting on it. Why? Because when they peer reviewed it, they had huge problems with it. And again, I'm going to post, another thing of the poor quality of the research done on Gc-MAF by these people who claim it work. And again, I had a conversation, not only in a past video ago, about a guy saying how it was, the pharmaceutical companies doing bad research. I'm sorry, it's these people doing the bad research, and it's the scientists and, in the UK, the Drug Standards Agency, showing, hey, these people aren't doing what they're claiming. Their drug can't do what it claims to do. They don't have the research to back it up. It's not very scientifically good at all. Where can we go from here? So that's real science at work, proving that, you know, Gc-MAF doesn't work.